Hi guys, welcome back to Nursing Guru. Are you preparing for the exam, especially the post-basic BSc students, right? So you have been seeing the sociology, the community health nursing, and now we are going to discuss in detail about the mental health nursing. Okay, so mental health nursing, we know that there is both the practical exams as well as the theoretical exams. So to see this each, that is practical as well as the theoretical, one by one, let's move to the video now. Now let's start with the question paper pattern, because let's start with the theoretical first, because you are going to appear the exam theoretically, that is in your institutions or the exam centers where they have given from the university. So let's discuss the question paper first, and then let's move to the syllabus or some of the important questions that comes in the mental health nursing. We all know that in theoretical paper, that is in examination, there will be 25 marks with a time duration of 3 hours. That includes the long essays, short essays and short answers as well. So in long essays, there will be 3 long essays. In that you need to attend any 2. In that 2, each question carries 10 marks, that is 2 into 10 is equal to 20 marks. And next, next is the short essays. In that short essays, again there will be 9 questions. In that 9 questions, you need to attend any 7. So try to remember that you need to attend only 7. Don't attend more or less than that. If you attend more, it is a waste of time. If you attend less, then it is that you are going to lose your marks. Clear? So attend any 7. So each question carries 5 marks. That is 7 into 5 is equal to 35 marks. The total weightage of short essays will be 35 marks. And next is short answers. In this, again there will be 10 questions, each question carrying 2 marks, that is 10 into 2 is equal to 20 marks. Okay. Now we know the question paper, the distribution of the questions along with each subheading or the long essay, the short essays or the short answers. We know how much mark each weight for, or the weightage of marks. We know everything about that, the question pattern. The time duration also we know, and the total marks in the theoretical paper, that is 75. And now let's see how much marks that you are getting from your institution side as an internal assessment. Here there is a 75 that you are going to score in your final exam, and the 25 will be getting from your institution as internal assessment marks. This is external marks, and that will be your internal marks. Okay, altogether is 100 marks. So in your result or in your mark sheet, it will be for your 100, showing that internal marks have been scored so much and external marks have been scored so much. Clear? So now let's see the practical session, the outline. We all know that in second year post basic BSc nursing, practical sessions is on research, the mental health and the community health nursing. So in community health nursing, same as there will be 50 which is given for internal assessment marks, and remaining 50 for the external assessment marks. Okay, that you are going to do or you will be doing on the day of exam, that is in the field work, in the community wise. Whereas in mental health nursing, the same thing will be implicated here as well. That is, internal marks will be that 50 marks, where you will get from your institution side by doing all case studies, case presentations, or completing the entire file along with the drug book, everything. So you will get a total of 50 marks from your institution side that will be carried as internal marks, and remaining 50 from your external, that you are going to case present in the hospital side, any mental health hospitals. Clear? So this will be the external and this will be the internal. Total together is 100 marks. The 100 marks is for your practical, that is community health nursing, mental health nursing, as well as the theoretical marks in your mental health is 75 plus 25, total 100. So clear with all both the practical as well as the theoretical? Now let's move to the syllabus. Okay, you know the question pattern and how it is divided both in theoretical as well as the practical. Now let's move to the syllabus, that what you want to study and what not to. So always try to be smart than the hard. Hard work will also help, but along with hard work, if you do some smart works, then definitely you can score good marks, right? So pick the points and then you frame in the exams by elaborating it. This is how you have to frame the answers in the examination, so that the time management will be managed accordingly and marks will be adequate or scored well. Okay, these tips you can follow in exams in writing your answers. Let's discuss the syllabus or the important topics that are covered in each unit in mental health nursing. We know that in mental health nursing there are totally 9 units. We'll discuss each one by one, starting from unit number 1. So the unit number 1 is all about the introduction and historical development in psychiatry. Okay, introduction and historical development in psychiatry. So introduction part, you have to study in detail about the history of psychiatry, historical development of psychiatry or mental health nursing, and next you need to know the principles or philosophy of mental health philosophies as well as the principles of mental health and psychiatric nursing. And next you want to study or you should know about the concepts of normal and abnormal behavior, because that defines the mental health and mental illness as well. Okay, and you should know in depth about the roles and qualities of a that is psychiatric and mental health nurse. Okay, both the psychiatric as well as the mental health nurse, you should know the roles and responsibilities as well as the qualities of a mental health or a psychiatric nurse. Okay, these are some of the important topics that you need to concentrate on unit number 1. So this is all about the legislations, okay, and also legal aspects, especially the legal aspects in psychiatric and mental health nursing, and also the mental health team, which carries either for 10 marks, this question or this concept will be either in 10 marks or 5 marks. Define mental health nursing and explain its functions or the team members. So try to give more importance on mental health team and functions of team members. Okay, this is all about the unit number 1. Now let's see unit number 2. So the unit number 2 in mental health nursing is the classification and assessment of mental disorders. So in this unit, the important topics that you can cover or the syllabus that you need to cover is the basic terminologies used in psychiatry and the classification of mental disorders, that is ICD-10 classification, okay, and also the history taking and assessment methods for mental disorders. So these are some of the important topics that you can cover in unit number 2, that is the assessment and classification of mental disorders as well as the etiological factors and psychopathology in general, especially in this unit. Okay, next is unit number 3. So unit number 3 is all about the therapeutic communication. Here you should know the concept of therapeutic communication, the definition, okay, and also the scope, objectives, and nurse-patient relationship, communication process, interviewing skills. Okay, these are some of the important topics that you need to concentrate on, along with therapeutic impasse and its relationship. Okay, therapeutic impasse and its relationship as well as and its management. So these are some of the important topics that you need to cover in unit number 3, that is therapeutic communication. Okay, which is main question will be from this question or this topic, that is therapeutic communication, because it is all about the nurse-patient relationship, that what we are going to build a rapport with the patient or everything. These components will be from this subunit or this topic called therapeutic communication, which is unit number 3. And next is unit number 4. So unit number 4 is all about the management of mental disorders. Here earlier the first 3 units is all about the general topics. Here it is a specific mental disorders. There are many mental disorders that are under this unit, so we'll discuss one by one which is more important. So before that, I will say how to represent or how to present these diseases or these mental disorders in your paper. If let's say there is a question that comes from that unit number 4, that is management of mental disorders, let's say any neurotic disorder like anxiety neurosis, or any psychotic disorders like schizophrenia, BPAD, that is bipolar mood affective disorder, or any affective disorders, organic brain syndrome, okay, personality disorders or disorders of childhood and adolescence. These are some of the mental disorders that covers in the unit number 4, that is management of mental disorders. How you have to write or how you have to present in your exam paper is start from the definition and write the classification, etiological factors and psychopathology. So either classification you can write or the types, etiological factors, psychopathology, Here it is not a pathophysiology, it is psychopathology, because it is all deal with the psychiatry. Okay. So definition, etiological factors, psychopathology, classification or types, next the clinical symptoms, that is clinical features, and diagnostic criteria, and finally how you have to write is you should end with the treatment and nursing management of specific mental disorders, what we have mentioned earlier. So this is how you have to start, or you have to present your paper from definition to the nursing management of a mental disorder, like let's say like example of schizophrenia or BPAD or any phobic anxiety, neurotic disorders, anything. Clear? This is all about unit number 4. Now let's see unit number 5. The unit number 5 here is all about the management of patient with substance use disorders. Okay, it is all about the substance use disorders and the management we will be seeing here. Under this unit, the important topics that are covered is mainly the substance use as well as the misuse. Substance use and misuse, as well as the dependence, intoxication and withdrawal, and also the same disease pattern you have to follow here. Okay, starting with the definition of substance use disorders, classification of psychoactive substances, etiological factors, psychopathology and clinical features, and assessment if required, and diagnostic criteria, treatment, and finally the nursing management of a patient with substance use disorders. So along with that, since it is a preventive aspect, you need to add more concentrate, or you should be more focused on the aspects, preventive aspects, and as well as the rehabilitative aspects. So the preventive and rehabilitative aspects in substance abuse. Okay, this will help you in scoring more marks in this unit, because it is a prevention method, right? So give more importance to this preventive and rehabilitative aspects in substance abuse. This is all about the unit number 5, and next let's move to the unit number 6. The unit number 6 is mental subnormality. Okay, so mental subnormality, here you should know about the definition, the concept, the classification of mental subnormality, etiological factors, psychopathology, again like clinical features, diagnostic criteria, and ending the treatment as well as the nursing management of a patient with mental subnormality. Okay, this is all about the unit number 6, that is management of mental subnormality. And next let's move to the unit number 7, that is psychiatric emergencies. Here you should know the emergencies of psychiatry, which is called psychiatric emergencies, and here some of the important topics that are covered, or the syllabus that are covered, that you can be more focused on is, that is the classification of psychiatric emergencies, definition of psychiatric emergencies, as well as the etiological factors, psychopathology, same as clinical features, diagnostic criteria, and the treatment and nursing management of a patient with psychiatric emergencies. And mainly one of the interventional therapy that you can give here in psychiatric emergencies is crisis intervention therapy. Okay, this is all about the unit number 7. And now let's see unit number 8. So unit number 8 is all about the therapeutic modalities that comes in the psychiatric or mental health nursing. So what are the therapeutic modalities? So it is all about the therapeutic modalities. Okay, in this unit you will be discussing, or you want to know more about each therapist. Okay, starting from the therapeutic community and also the therapy called milieu therapy, therapeutic community and milieu therapy, and also you should be more familiar with the principles, indications, contraindications, and role of a nurse in various or different treatment methods. So what are different or various treatment therapies or methods are? Occupational therapy, behavioral therapy, family therapy, psychotherapy, pharmacotherapy, electroconvulsive therapy, and other miscellaneous therapies. So these are some important therapies or treatment modalities or therapeutic modalities that are present in the psychiatric nursing or a mental health nursing. Okay, you should be more familiar with the principles, indications, as well as the contraindications, and mainly the role of a nurse in all these treatment or therapeutic modalities. Clear? And the last unit is the preventive psychiatry. So in this unit, it is all about the prevention of mental illnesses. Okay, so we have discussed about the mental health, mental illnesses, how to manage everything, but this last unit is all about the prevention, so which is called a preventive psychiatry. The last unit is preventive psychiatry. Under this unit, you need to be more familiar with the models of prevention. Okay, the models of prevention you should be more familiar with, and also the preventive psychiatric roles, the role of a nurse in preventive psychiatry and community health, mental health nursing. So we have discussed the community health nursing in community health, whereas here it is community mental health nursing, community mental health agencies, as well as you should know more about the national mental health programs. Okay, these are the important topics that covers under the preventive psychiatry. So make sure that you are more familiar with these, some of the important topics that we have discussed right now, and the syllabus try to cover as much as possible, especially the important topics what we have covered now. So definitely one or the other question will be in your exam, and I would like to say that since there is an options for you people, that is second year post basic BSc nursing, there is an options, that is one option from long essay and two optional questions from short essays. There is no actual weightage dividing, that is marks weightage dividing is not there for second year post BSc nursing. Clear? Not only for second year, even for the first year. Entire first and second year post basic BSc nursing, there is no exact division of marks according to each unit. The reason why is there is an optional questions for long essay as well as the short essays. So this is the reason where there is no exact division of marks according to each unit. So you should be proactively study or read all the units in such a way that try to cover the important questions what we have discussed now. So the important questions what we have discussed according to the syllabus will be the same in the final exam as well. Clear? So this is all about the video of mental health nursing, that is you are preparing for your mental health examination, either for the theoretical as well as the practical. So try to read as much as possible with understanding concepts as well as the principles, the scopes, objectives, and correlate each units and the syllabus what we have covered or what we have discussed. Okay, so this is all about the mental health nursing we have covered in this unit, in this video. That is the importance, everything. If you have any further doubts or any queries, please do comment in the chat box, and if you are new to our channel, please subscribe, like, share. Thank you.